Hello, this is Dr. Bryan Dufrene with Back and Neck Pain Relief. I have one of my patients here, Randy Gravier, and he'd come to see me a while back. He was having a lot of complaints with his neck and just all the way along his spine. And this is Randy. Tell him what was going on with you.
In about 2009, I met Dr. Dufrene, and I was having severe depression and back trouble. I had 9 balls of disc in my spine, and my mom referred me to this clinic, and I thought it would be no different than any other clinic. And since I met Dr. Dufrene, I have little to no depression, and I do function on a normal basis because of his treatment, and we really appreciate that from Dr. Dufrene. And he's I think way better than the rest. They also do the dry needling, and it helps for several occasions, different, helps my feet, my back, my neck, everything. On a weekly basis I come in and I do the exercise he recommends, and I'm doing way better today than I was before. Yeah. And I think he's a lot better than all the rest of the chiropractors.
I appreciate the compliment, Randy. We're going to go ahead, we're going to show a little bit of the type of treatments that we've been doing on Randy, and kind of give you an idea of some of the things that we do in the clinic. Okay, so we have Randy on an adjusting table. This is a motorized flexion distraction table. So you can see how the table moves up and down, and this puts a little bit of traction pull on his back. Today I'm going to be doing the adjustment using an instrument. This is called the arthrostim, and it's a type of technique. It's called mechanically assisted adjusting. Basically what this does is this puts a little tapping motion, and it's to create motion in the restricted areas along his spine and help with the alignment issues and things like that. So basically I'm finding the spots, and while the table's pulling, we put motion in those vertebrae. This is a really comfortable type of treatment. When we do this type of adjustment, there isn't any cracking or popping, nothing like that. But it does help to get things moving better, better alignment. You doing okay, Randy?
Yes, sir.
Okay, now I'm going to be using the same instrument again, but this time we're going to work a little motion in some of these tight areas along his spine. So I'm going to have you turn your head. I'm just going to place the instrument right along the neck with a little motion. And what I'm feeling for, we're just feeling for where there's restriction, where it's not moving properly. And you can feel right up in that little spot right over here. Just like that, and work a little bit in the curve. Okay. Now the next thing we're going to do is we're going to do a little bit of dry needling along his spine. All right, we're here with Randy again, and I'm doing a little bit of dry needling. We're going to be doing some needling along the cervical spine, the neck area, and basically along his thoracic and lumbar area. I'm going to be going fairly light with the needles today. Okay, next what I'm going to do is we're going to apply these little alligator clips. These are going to run a little bit of electric stimulation through some of the needles. We're going to focus this today on his lower back area. And this little unit is just a little battery powered unit, and it puts out a little bit of a stimulation into that area. So we're going to go ahead and get first channel started. Just tell me when it's getting in there a little strong.
All right.
What does that feel like?
Feels like a little picking.
Okay.
It's not bad.
Is it like a little pulsing feel?
Yes, sir. A little pulsing, yeah.
Mm-hmm. Okay, here's channel
Okay.
2. You good right there?
Right there.
That's it. We generally leave this on for about 6 minutes or so, and then we take the needles out after. Okay, we with Randy. We own a piece of equipment that we use. One of the pieces we use for doing rehabilitation, strength restoration. This one's for the lumbar spine, lower back area. The type of equipment we use is called Med-X. Med-X is considered by many to be the absolute best rehab equipment that is available. They have over 30 patents on their machine, and they have over 70 published research articles, which I believe would be more than probably any other rehabilitation equipment on the market. This equipment is designed to isolate the lower back. It takes the hips out of the exercise, the legs out of the exercise, and it actually causes the patient and kind of forces them to use the lower back area where we want to focus this exercise. Also, the machines are designed for safety. They've done a lot of different types of research on these machines, and one of the things they found is that you really have to get down to those deep muscles in the lower back, the multifidi muscles, and the ones that are real deep in the back that really help in stabilizing the lower back. How's the exercise feeling, Randy?
Good.
It gets pretty intense, so after a little bit.
It's intense, yes, sir.
Yeah, and we do the exercise really, really slow, and it's very controlled. The machine actually just guides you through the motion, so it kind of prevents you from doing anything wrong. It kind of helps you to make sure you do the exercise correctly. And we've been using the Med-X equipment. We have it for the lower back. We also have a similar piece of equipment over here. This is for cervical spine. And we've used these for years, and we've had some fantastic results in getting patients to where they can become more functional and start doing their day in and day out type of activities and not have the problems they had before. This is Dr. Bryan Dufrene at Back and Neck Pain Relief. If you're interested in any of these type of treatments, just call my office and we'll schedule a consultation. We do offer a free consultation to see if you're a good candidate for these type of procedures. Till next time.